You're listening to the Belmar Bites podcast, brought to you by Belmar Consulting. Hey, everybody. Welcome back to our podcast. I'm excited to once again have Matt with me, and more excited to have a colleague of ours, Eleanor. Thanks for joining. We're super excited you're here. And Eleanor, probably the best way to kick this thing off is for you to just give everybody an introduction. And, what I'm hoping to hear is an introduction to you, your organization, your background, and we'll jump in and interrupt you, I'm sure, as we go through this and double click on things. But why don't we start with just an introduction? So, Eleanor.
Well, first, thank you both, for just chatting with you. But I am Eleanor Castillo Sumi, founder of Ohana Healthcare Partners, a consultancy that includes many partners like Belmar that come together to help solve problems for our organization. The agency started because we wanted to bring in the best in class for organizations to be able to accelerate their implementation or their digital transformation, which is a key part of the work that we do today. But I'm a psychologist by training. I used to work in California's largest behavioral health organization, built their business infrastructure to develop new programs, from their autism program to expanding their school-based program to implementing certified community behavioral health clinics, and now implementing California, the initiative under California Advancing and Innovating in Medi-Cal, which is called CalAIM in California.
Awesome. Awesome. Well, you've been a huge advocate of Belmar. You've helped us a lot, and we share a number of customers today. And I know you and Matt. I think you and Matt probably, I would say, know each other a little better than you and I know each other, Eleanor. But it was actually I don't know if you remember this story. I got introduced to you through one of our friends at Salesforce,
Hmm.
and I reached out to you through email, and you kindly didn't respond to my first one, and I sent another one, and I think you may have responded to the second one, but it took a little bit of persistence on my part to get us connected. And then I remember, I think it was maybe the first call we had. You were like, Scott, this is really great, but like I'm off to Europe tomorrow or 2 days later, and like let's reconnect in 2 weeks. And then I think it worked out that I was heading to Europe on vacation shortly after you got back. And so I said, "Hey Matt, I've met this amazing person called Eleanor. You got to pick up the torch here and have a conversation." And I think the rest is history. We've had a couple of years working together, and it's been really fun. And so I guess, Matt, with that, you know Eleanor, and what's maybe one of the key characteristics that you can use to describe just the tenacity that she's got for just excellence with her customers.
Well, I find it so interesting and helpful for our listeners to hear how you two got introduced. So, yes, you're right. You passed the torch over. My first interaction with Eleanor was I was with Elisa, one of our account executives, and we were close to an hour late to dinner. So, think about first impressions. Being an hour late to the first time meeting somebody is just not a great start. But I remember distinctly after a treacherous drive, let's call it, to the the bowels of San Jose or Palo Alto, showing up, Eleanor just sitting there with her glass of wine, just so welcoming as well. And I think that that welcoming nature is just you could get that sense within the first 10 seconds of meeting her as well. And it's why we continue to partner with her, and we're grateful. We're grateful for you, Eleanor, and just lots of wine. That's perhaps why we know each other so well, but also a shared kind of common interest and passion for like how do we do things better. And I think we'll get into a lot of it today, but just like there's so many opportunities, and when you try to boil all of it together, it can seem very daunting. But when you make these small incremental adjustments to what is otherwise a pretty challenging system to work within, it's this is stuff that fills the cup as well, like stuff that you can start to see. This is the effect for this CBO. This is the effect for this program here. So doesn't really answer your question, Scott, but I also
No,
left
that's
a
great.
bad first impression with Eleanor being late. And in fact, I think every time I meet her for dinner, I'm probably late in some capacity. So Apologies, Eleanor.
Oh no, it's nice to have someone later than me, and I'm usually late.
Well, Eleanor, we have people that listen to this, and they come from different backgrounds, and many of our customers are in the not-for-profit sector, and but it's such a wide and diverse group of customers and just contacts that we have in the industry, and we love sharing these conversations. So I guess maybe just help unpack a little bit more in terms of what it is that you do, what your organization does for your customers, and yeah, just pick some highlights of kind of what you do, and just to frame this for those that are listening.
Yeah, so I think, well, let me actually tie my response back to the beginning. Scott, I would say, probably a reflection of where I grew up on a really small island, where trust is a big thing. I mean, everyone talks about trust, trust being really critical, um, a really, critical ingredient in what I believe is to be successful. That is probably why I, am not too eager to jump into any kind of just partnership. That trust, comes also with the aloha spirit, Matt. So, again, that welcoming. And for as long as we have shared values, I think that's why we work so well together. I mean, it isn't easy work. I don't think anything that we love doing is easy work, but when you're working with mission-driven organizations, trust is a big thing, right? And so I think I get that. I empathize with them from that perspective. We've dealt with coming from the nonprofit space. We deal with a lot of vendors that push their agenda, and try to push their agenda within the mission. Um, and when things don't go well, it's because they're pushing their agenda. And so I think that's what differentiates Ohana from other vendors is that we get where they're coming from and we try to bridge their mission and the products, if you will, that can help them support their mission rather than pushing products for the mere sake of pushing, whether it's a platform or tools. But it really should be human centered in the sense of, okay, what is it that we're trying to solve? And I think organizations get that when working at Ohana. We'll have the hard conversations, and they know, though, that those hard conversations come from a place of trust,
Mhm.
um, and knowing that we're there for their benefit, and so to be part of their mission and their journey to me is is a privilege,
Mhm.
and I want to work with partners that also share that same value.
Eleanor, I wanna double click into and appreciate you sharing that. I wanna double click into some of your history, because I think it's worthwhile to share, just how you went from psychologist to progressively different leadership roles in nonprofit organizations to starting Ohana. So first off, how old is Ohana, and what prompted you to start Ohana?
Yeah. Oh, so Ohana is 3 years old, um, and it really was in response to making sure that all organizations that serve the underserved populations really have access and the resources just as much as any other large nonprofit or for profit, that they too could benefit from what a large nonprofit can have. Maybe it's not to the same breadth and depth, but it really is, again, really that underdog fight and passion, fighting for health equity. When you're talking about health equity, that means all of the different players, right? It's not just your big organizations that have all these resources. And so that's kind of what prompted me to, go on my own. I'm very grateful for the experience that I had, as I was with the last company for, almost 15, 15 years. But in that span, um, again, with my psychology background, I was a director of quality assurance, which also then meant, again, measuring measuring work, measuring improvement. I also did program evaluation. So again, the quality of data was always an issue or a focus in all of my work, to building new business and, being methodical about building new business, especially in a nonprofit, right? That doesn't have a whole lot of seed money, if you will, to build these new programs. So it comes from, again, just wanting to do things differently and knowing that we need to do things differently. And I think that's a key part of our work where, there are solutions out there. It's not a matter of, having solutions or having ideas, but it's how do you think differently, to make things happen.
Yeah. And there's so many questions I could ask. Obviously, we have limited time, but maybe just a part two to that question, and then I'll tag Scott in here. So you went from progressively larger organizations, a clinical background, to starting something brand new from the ground up. Maybe pick one and a really big lesson that you've learned, starting something from scratch like that as well. In this, I'd love to just hear how that's going, and yeah, what's one takeaway that you've had thus far?
You cannot take yourself seriously, too seriously. To just be open to learning and failing fast, and continuing to have that sense of urgency. Um, but it's not just me, right? I can't have that sense of urgency by myself. And so it's all these partners that come together that have the same value, and that same sense of urgency, that same sense of accountability and responsibility to our clients and to the communities that they serve. Um, is probably the biggest thing is, again, I mean, just finding partners that are like mind, um, will either accelerate or be a blocker in progress. But again, that's a journey, right? I've certainly met partners that don't have the same values, which is okay. Um, but for me and for Ohana to accelerate what we do, it's important to have, partners of like mind and value.
Yeah. Yeah, yeah. Well, we certainly share that, and Eleanor, I just want to come back to just framing what it is Ohana does. So you've described you have a bunch of partners and you work together, but what is the solution? What is the maybe better said, what is the outcome that Ohana is delivering to its customers?
So the outcome is really based on, what the organizations need. It can be anything from helping them just better understand their current technology stack or helping them find solutions. But it's usually not just a single thing, if you will. It's usually a workflow, a process. And so it's how do you bring these things together? Most of them work in a complex environment where they have multiple systems. Um, so it's not, again, just implementing a single product, but how does that product operate in the larger picture? So from the technology standpoint, again, it's whether it's helping them architect something, developing a technology roadmap that's pretty comprehensive from, your network to uh, mission critical systems like Salesforce or an EHR. How do you bring all this data together in a data warehouse so that it can be usable, clean, repeated data to cybersecurity, doing, penetration tests, whatever that case might be on the technology side. And then on the program side, I have a team of people who are very well versed in working with managed care plans, health plans, so assisting along the contracting process, uh, helping with development of policies and procedures, training, developing financial models, marketing assessments. So it's a pretty comprehensive package that we can offer clients. So, it's basically a one-stop shop for them if they need any of these items. And again, the partners that I'm working with have the same values. Um, and so, when they're working with Ohana, they're working with a diverse group of independent consultants, that have the same common goal, which is to help the clients
Yeah.
that we
Yeah.
serve.
And in 3 years of history, describe, your customers are located, from what I understand, mostly in California, but, are you working outside of California?
Not a whole lot about outside of California, but yes, primarily in California, but throughout California, from Sacramento. Initially, we actually had client in Ukiah, down to San Diego, as far east as Fresno, Los Angeles. So we get the rural areas, large, small organizations, with different resources available to all of them, different leadership. But it's a great way to have a larger impact by working with all of these different organizations.
And does that happen to be California-based because of your experience, your expertise, or how did that happen in which most of your customer base and client base was California?
Yes, so it was primarily my contacts. It was a natural place, an organic place to grow the company, and but the consultants that we work with are all over. I mean, you guys are in Canada and Florida. Um, I have someone in Washington, D.C. that's a consultant. We have someone in Indiana. So it's really all over the the continent, I should say. um, yeah. But all, again, primarily working to help organizations in California, at least at this point.
Yeah. Yeah, and I think that's interesting. You talked about where these customers and clients are oriented. I guess when you think about your typical customer,
Hmm.
um, what what is the typical type of organization? You don't have to share size or whatnot, but just what are some typical characteristics of the type of customer that you work with?
Um, they tend to be primarily, they tend to be primarily behavioral health organizations that serve individuals that have involvement in multiple systems. So, for example, with kids, you have, the schools, maybe foster care, maybe juvenile probation, and then with adults, you have maybe juvenile probation or they have some employment needs. But again, very complex because of how the system is structured. The system is structured to keep the different components of an individual life all siloed, right? So you have employment needs through one certain system. You have school needs, in another system. If you have developmental disabilities, that's administered through another system. And so the system around providing services is very complex, and which is why a lot of organizations have multiple systems. And if you work in multiple counties in California, I mean, just pretty much consider it multiple states. Each county is very different, even though it might be the same service, such as foster care, for example. They run differently in each county. And so having that level of appreciation, in working with these organizations, I think is key. And that's why it's never really just one solution. They're usually connected. Um, but whether or not it's a $5 million organization or a $250 million organization, most of them have multiple payers and are dealing with multiple systems.
Mhm. Yeah, I'm gonna go off on thanks for sharing the typical customer. I'm gonna go off on one thing that you said there, that there's differences, like working with different counties, there's difference, even something like foster care. I'm wondering if there's many who listen to this that they're trying to imagine this in their organization. What are some of those nuances that you've seen or differences? And part two to that, what impact does this have when you think about data and reporting and whatnot? So maybe start with the differences of even foster care amongst counties.
Let's just take CalAIM as an example. Um, in one county, you might have a county specific health plan that does business a certain way. And then in that same county, another health plan doing business a different way. So one might want you to enter data into their system, another will allow you to have your own system. But at the end of the day, you're responsible for your data, right? You need to have a 360 view of your clients across programs, whether it's being able to manage a program across an organization across multiple programs, or understand the care that is being delivered to a single client across multiple programs, you're still responsible for your organization. And so how do you, manage an organization where you have multiple data in different system is really the key issue that we often are solving for. Still meeting the payer requirements, still being compliant, but also at the same time trying to make the day-to-day lives of those that are delivering the services much easier, right? And the recipient of those services um, feel like the services are comprehensive and seamless, that they're not repeating their journey. And so that is often the question that we try to solve. And I remember the days where we used to try to ask, one county or one payer, can they label things the same? One asks for sex, the other asks for gender. And with today's technology, you don't need to do that anymore. You can figure out different ways of data going between systems, where a data warehouse, so having a data infrastructure to allow for multiple data to come, sources come into a single place, transformations, and then it being viewed in a way where it's useful for those that need to consume that data for whatever purpose, whether it's to manage, again, an organization or to manage care. You now have technologies today to make that really easy, right? You no longer have to go into multiple systems to enter data. You no longer have to go into multiple systems to look at data. You no longer have to double enter data, but that still happens. That's still very much a common problem today. And so helping organizations really, um, again, be able to integrate their data, optimize the data that they have so that they really can truly transform and take things to the next level, is a large part of what we do. And so having, technologies and systems that have all the different criteria that they need to operate is a key part of, of the assessment and the consultation that we provide.
Yeah. And maybe real quick before I tag Scott in here, you said CalAIM. Maybe for those who don't know, CalAIM stands for California Advancing and Innovating Medi-Cal, which is a 5-year initiative by DHCS. And that's the kind of construct that you work in and are supporting a lot of organizations. Just for those
All
who
right.
have not heard CalAIM
Yes. No, I
before.
appreciate that. Yes.
Yeah. Go ahead, Scott. I'll tag you in.
Thanks for clarifying that, Matt. I didn't know if I think I read that somewhere before, but that was helpful. Eleanor, in terms of partnership, we've had the pleasure of working together now for, I guess we're in our second year for sure, and you shared this idea of shared values, working together collaboratively to deliver these outcomes. Uh, give us a success story that you've experienced, that you've seen with a customer. Doesn't have to be tied to one that we've worked with you on, but just like a before and after picture of what success looks like. And for organizations that might be listening to this, like how can they get there? And it's kind of the part two of that question. So start with an example of just a success story that you've seen.
Yeah, I mean, there's a number of what I would determine as success, and it's not an end state to me. It's
Mhm.
a matter of process, right? And so when organizations, as I mentioned, a lot of them have to deal with multiple vendors, and sometimes simultaneously, and you just never know who to trust, right? You have one vendor that's saying one thing, you have another vendor that's saying another. How do you make sense of it? How do you integrate all of that information and make it work for you? So when there's a process for those things to happen, those conversations to happen, to me, that's success, right? Where, with one customer, we have, they're dealing with four vendors simultaneously. Their Salesforce partner, their EHR partner, a data warehouse partner, and then you have Ohana in the middle of all of that. And so how do you get all of these partners to be rowing the same direction, even though they all have different purpose, and different function within the organization. And so when you have a forum, to coordinate those conversations, to have those difficult conversations, to me that's success because that's something that they'll learn moving forward, right? So no matter what happens, if they need to upgrade some other technology or integrate some other technology over time, which they should expect, then they now have, those muscles, if you will, built in within the organization to manage multiple projects, multiple vendors, to know how to ask the questions. It's not that they need to know everything, but be able to ask the questions, right? And pause conversations, so that they feel confident in what they're receiving. So to me, that is success, and we have a number of different clients where that is the case. They're in different places, if you will, with their implementation, with their trajectory, with the resources they have. But if you have a place where a structure, it's more than just governance, but a structure to manage all of these things, then we'll lead them with something more than just uh, technology, that
Right.
solves their day-to-day problem.
Yeah, yeah. Well, I mean, we're big believers that, I mean, technology on its own is not going to solve your problem. It might actually amplify your problem, and so I think what you're describing, that makes a lot of sense. Um, you're you're essentially equipping these organizations in the present time or in the current state to not only solve the immediate, but to really solve for the future, and giving them a framework to do that. Um, in terms of just I guess where you started 3 years ago, and where this cohort of organizations that you've worked with were at compared to where they are today, let's talk about where will they be in the future? What are the big trends that are happening right now in this industry?
Yeah, no, I'm excited to see where they'll be. I mean, and it's not going to be very far. I mean, a lot of these organizations are building their data infrastructure, um, and so they'll move from cleaning data, entering entering data into multiple systems. A lot of human error processes, to now having technology work for them, where they can invest their time in doing the things that they like to do, whether you're a clinician, or whatever the case might be. But hopefully, they'll get to a place where they can now get into predictive analytics, looking at their outcomes differently and advocating for themselves through value-based contracting, because the playing field will change. And I think these organizations are positioning themselves to do just that. To be an equal partner in this larger system that's changing, rather than being pulled by the system that's changing around them.
Mhm. Can you just unpack like the value-based model that you described?
Yep. So, today the contracts tend to be fee for service. You deliver a service, you get paid for a certain service, right? Um, but there are a lot of things that a person might need that might not be refundable, by a payer for, or that you'd have to do different things to get payment by another payer source for a different, for that service. Um, but in the world of value based, if you were to just say, okay, we're going to serve these people, give me X amount of dollars to serve these people. We'll keep them out of the emergency rooms. We'll make sure, their well-being. So not just their physical health, dental health, but their overall well-being, is maximized, and that people have houses and jobs. You give us that responsibility. You pay us for that, and we'll take care of them. But to be able to do that, you need to know your cost, and your cost is not just, a service you deliver and then what you get paid. It's everything,
Mhm.
right? From having the time to sit and think about that that treatment plan, to care coordination, um, making sure that people have the training that they need to operate in this different space. All of that all needs to come into play. People drive places, and reimbursement is not for driving is not a common, um, item that organizations usually typically get reimbursed for. But that's a very critical part of
Yeah.
doing business when you're doing business in the community. And so when you look at the total cost, right, to be able to say, here's what I can do, with this population. You can segment your data, and that's what, again, having that a robust data infrastructure will do. Understanding what outcomes you can achieve with what types of, resources or staff, to maximize your outcomes. That's the kind of things that these organizations will be able to do. And so they don't have to nickel and dime how to do business. They don't have to figure out how to rob Peter to pay Paul.
Yeah.
That they can just do business um, responsibly and respectfully of the people that they serve.
Yeah. Yeah. Interesting. So where like you see like where are we at in that journey right now in terms of transitioning out of the old structure to the new structure?
I still think, I mean, Matt mentioned CalAIM is a 5-year journey,
Mhm.
and we are in year 4 of that 5-year journey, and that's not going to stop next year, in 2007, 2008. Um, it's a journey, and these organizations are continually evolving. The landscape around them keeps changing, rightfully so, because as the state is learning, all of that gets then trickled down, to the provider level. So I think we're very early on in the transformation. Not a whole lot of organizations can optimize their data today, and you need to optimize your data before you can go through transformation. So it really is in the early stages, I believe, of organizations getting to that point. And as we think about health equity, again, it's organization equity, right? Your smaller organizations that are providing ethnic specific services need to be a part of that that journey. And they're the ones that often don't have the resources to do that, but the ones that need most of the resources to do that. So it's looking at it, from a whole, looking at all the different partners, how it's coming together. And I still think, again, we're very early on in that journey, but I think the direction is clear. We're heading a certain place, and now it's a matter of how we get there and we make sure that all of the organizations can come along as well.
Yeah. Thanks for sharing that, Eleanor. I like how you've kind of categorized it as it is a journey and the landscape is evolving because absolutely, even just we talked about CalAIM as well. It it would be fickle to think that it would be solved in 1 year's time. But maybe just evolving this conversation as we wrap this up to just advice. And as we look out, or if there's an executive director that's listening to this that is maybe on the cusp of evaluating their technology transformation, like what's one piece of advice that you would share with them that let's just say they're a CBO as well. What's a piece of advice that you would really have them follow when they're evaluating technology or getting into this journey here?
That they really should think of technology as a strategic investment, and not just as an afterthought. And so when you're thinking about strategy and, services, that technology is very much a part of that. Um, and it's it's easy to see the cost of technology, right? And implementation costs, license costs. But what they often don't see is there's a cost to not having technology. And the cost to not having technology is greater than the cost of investing in technology. So I think investing in technology and seeing technology as a strategic asset is going to be my biggest advice.
Yeah. Well, hey, that's a great way to that's a soundbite in itself that we should capture. Maybe just in close here, and Scott, I'll let you throw in anything else if you want. If somebody wants to reach out to Eleanor, like how can somebody learn more about you, connect with you? What's the best way to do so?
They can go to our website, ohanahcp.com. And we have a contact there. We have some general information there, but that would be a good way to get in touch with our team, or you can email me directly, ecastillosumi@ohanahcp.com. Or you can
Great.
contact my Belmar colleagues here.
Yeah. Well, we'd be happy to get you connected. Okay, so Ohana HCP, Ohana Healthcare Partners.
dot
dot com. All right. Awesome. Eleanor, thanks for doing this. This was fun, and looking forward to getting together soon. And as Matt had shared off the start, having a glass of wine together. So
Yep.
it's been a little while. So thanks for doing this. We're super grateful for your time and for the knowledge that you brought to this conversation. So thanks everybody for listening, and we are going to wrap on that. This has been another episode of Belmar Bites, brought to you by Belmar Consulting. You can follow us on Apple, Spotify, YouTube, or on our website at belmarcloud.com.